And she is also, Dr. Salazar is also the mother of a daughter named Savannah who developed Lennox-Gastaut syndrome when she was 2 years old. And then it started her on this journey to getting her PhD. And then during her research tenure and after 16 years of watching daily unrelenting seizures in her child, she uncovered the genetic driver of her daughter's illness and identified a novel precision therapy that improved her daughter's life. What we will be doing today is a Q&A with Dr. Salazar, specifically related to the COVID-19 era. And you will notice at the bottom of your screen, there is a chat. There are two options for talking to us and asking your questions. One is a chat and the other is Q&A. You can really use either one. So please, ask us your questions, and I'm sure a lot of questions will come up throughout as well. So I'd like to hand it over to Dr. Salazar, and I'll mute myself. And Tracy, take it away.
Great, thanks. So can you hear me all right? Yes, Jen?
Yes.
All right. Well, it's great to be here. Thank you guys for joining. I know that all of us are overwhelmed and dealing with a lot in our daily lives, given all the changes that are going on worldwide. So hopefully this webinar will help to answer some questions, point you to some resources. This is me, Tracy. This is my LGS daughter, Savannah. She's 26. I do have a PhD, but I am an LGS mom here to talk to you more about what we're hearing in the LGS community from our families, what we're hearing in the broader community from our partners at other disease-specific nonprofit organizations, our partners in the medical field, clinicians, researchers, the FDA, others, what we're hearing overall in this time of great uncertainty. I certainly do not have all of the answers. I am not a medical doctor. I'm not offering any medical advice or any advice at all, other than to point you to resources and then to tell you how we're dealing with it in our family, how we're kind of dealing and what we think to expect. Unfortunately, what's going on in the world right now with COVID-19 is changing every day. It's evolving. Our understanding of the disease is evolving. Our understanding of how we might bounce back against it is evolving, and it's not going to be any quick and easy answers. So, but the LGS Foundation is here for you and wants to be here to try to help point you, if you have questions, point you to resources that exist out there to help get your questions answered. There's a lot of questions we can't answer right now, and that's very frustrating for all of us, but we are here, we're in this together, and we're going to try to do the best we can as the foundation to get your questions answered. Some of the things that I want to talk about today that we'll try to address are, first of all, just some basic information on COVID-19, some sources that you can look to. I also want to talk a little bit about protecting your loved one from the virus, caring for your family at home, all of these issues that we're dealing with, how we're thinking about getting medical care during this time for our loved ones with LGS and for our family members, some financial assistance programs that we're aware of, the importance of caring for ourselves during this whole time, and then what the foundation is trying to do to help. At the end, of my very short, probably 10 minutes where I'm just going to chat for a minute with you guys and then open it up to questions, I'll talk a little bit about what we think the future might look like, what we're hearing from, the Center for Disease Control, from scientists, from the people at the FDA who are actively, working on scientific solutions to this problem. So we'll let you know what we're hearing from them. And of course, we don't have any strong answers about, when we're going to get back to real life, but, at least there is some hope on the horizon. At least there is a plan. So we'll talk about that. So I wanted to just direct you first to the LGS Foundation's COVID-19 page. If you go to our website, www.lgsfoundation.org, you can come to the COVID page. It's under resources. It's the first page there, COVID-19. We have a list of resources here for some of the links I'm going to be talking about. Where we're getting a lot of our information at the foundation is not the news. In fact, I personally have had to take a break from the news because COVID has become politicized, and I'm not really interested in, you know, knowing what this party or that party thinks about COVID. What I'm interested in is what I can do for my family right now. I just need to know what the facts are without, being this political football that's bouncing back and forth. So, so the Center for Disease Control is one of the links on our site. So you can go here and you can read about what the recommendations are for the Center for Disease Control. This is the United States Center for Disease Control. If we have anybody on the line that's from outside the US, the World Health Organization, the WHO, is a website link that you can also find on the LGS page for information. But you can find information here. You can learn more about COVID-19. What are the symptoms? You know, how do you slow the spread? What about cloth face covers? What about critical care workers? I have a son who is an EMT who works at a hospital emergency department. I'm very worried about him, and I haven't seen him since, you know, this whole quarantine business has happened. So ways to check yourself, you know, whether or not you should get tested. So all of these things are on the Center for Disease Control website, and you can go and read about them. And these are going to be scientifically backed. They will often give you references in these, and I'll just give you one example. So one of the questions that we got before the call was about face masks. Should you wear a face mask? You know, what are the recommendations? Well, according to the Center for Disease Control, they are recommending that you wear a face mask when you go into public, a cloth face mask, a face covering. We're not trying to stockpile N95 respirators or things and take those away from the emergency care workers. But they also link to the reasons why. So if you look here in the first paragraph on this site from the CDC, it says they're recommending it because we now know from scientific studies that people who are asymptomatic, so they don't have any symptoms, can carry COVID, and they can be spreaders of it, and so can people who have very mild symptoms or pre-symptomatic. They're not in the full-blown aspect of the disease, can also carry it and can transmit it to others. And if you click on the recent studies link here, it takes you to the studies that they're quoting them from, the scientific research that they believe backs this. So, so they are recommending that you wear a mask when you go in public and that you still practice strong social distancing. Depending on what source you look at, you know, this is our United States, you know, scientific platform for diseases. You can go to them, but you can also go and look at your states, right? So I live in California. My state has very specific information for what they want us to stay home here in California, avoid going outside, having people in our house, washing our hands, of course, because we know social distancing and hand washing and face masks can be helpful. They're not completely preventative by any stretch, but they can be helpful. So this is a place you can go for your state resources. Every state has one of these at this point, and if you have trouble finding it, we can certainly try to point you to your states. If you reach out to Jen, and we can point you there, or myself. And then you'll have a local one. So I live in San Diego, and here's the information from San Diego that's coming in. Again, all of these things being based on information that the governments are getting from other states that are dealing with the disease, other countries, scientists, experts, people who are guiding us. And so in San Diego, they are still telling us to stay home, except for essential needs. So I would really encourage you, if you're looking for basic information, to look at the CDC website, the WHO website if you're international, if you're not in the US, but also look at your local websites if those exist. So, you know, down to the city if you can, because they'll be a really good source of information about the facts for you. And those are all listed on our website so that you can go take a look at those. I would also just want to mention a couple of resources that are out there well, let me just talk about protecting your loved one first. Let me just go back and then I'll talk about those in just a second. So there are some resources on our website about our loved ones. I think the biggest bit of advice that I can give you based on everything that I'm hearing, and again, it's not medical advice, it's just what I'm hearing, is that we are all responsible now for ourselves and for our families on keeping them safe. There's nobody that's going to do that for us. I have an LGS kid here who is at high risk, probably much like your LGS kid. My husband and I live here. You know, if we bring COVID home to her, we don't know what will happen. We also don't know what will happen with us. My husband is, you know, sort of in the prime age. He's, you know, 59, you know, for getting this and having bad complications. It's not guaranteed because that's his age, but you know, I don't know what will happen to him. I don't know what will happen to me if we get it. It's possible we've already had it. I don't know. We've had like little colds and flus running around, but we have no idea. But we are all responsible. And so it's up to me to decide, you know, to listen to what my state is saying. Obviously there's laws and things in place about quarantining and self-isolating, but also, you know, how much I go out in the world is dictated by me needing to take care of her, protect her. We are responsible for doing that for our loved ones. And so I think that's the best bit of advice that I can give you is, you know, what are you comfortable with? You don't know who's carrying it. You know, they could not have symptoms or they could be pre-symptomatic and carrying COVID. We know that this is a totally new virus that the world has not seen before. Not coronaviruses per se, but COVID-19. And so basically there's, you know, nearly 8 billion people in the world who haven't had it yet, with the exception of those obviously who we're hearing about in the news that are getting it. But so we all you know, think that we're naive to this virus and that we'll get it at some point until there's a vaccine. So you have to decide what you're most comfortable with and how you're going to protect your family, in addition to listening to the laws and looking at the website on what the guidances are and what legally is being asked of you to do. There are some places that are saying, you know, some states and some provinces that are saying, you know, no, you have to stay in your home. So you have to really look at that as well. We do have a number of resources on keeping your family safe during this time that you can click on the LGS page. Again, this is the LGS COVID-19 resource page, you know, for families and caregivers on, you know, keeping your kids safe, what to look for if you think that they might have symptoms of this. So I would really encourage you, advice for caregivers of kids with disabilities, and definitely the more fragile population. For the more fragile populations, the recommendation is really to self-isolate, you know, and to really not go out unless you absolutely need it. And when you do go out, to make sure that you're, you know, wearing a mask and practicing social distancing and washing your hands and making sure that you don't bring anything back into the home. This is an illness that spread through droplets and, you know, from the nose or from saliva, and droplet of moist particles, and then it somehow gets into your respiratory system, to your nose, through your mouth, or in those ways. And so, you know, you want to not bring anything home. So those are definitely places where you can get more information just on caring for your family, but it really is up to you to protect your loved ones and make decisions about social distancing while you're listening to, you know, the authorities as well. I know some families that, you know, one person goes to the grocery store, that person comes home, they change all their clothes, they wipe down everything that they got with like sanitizers, and then that stuff comes into the house, while as other people are more relaxed about that. You know, I think a lot of groups have canceled their nursing, a lot of families have canceled their nursing care, canceled, you know, other family members coming into the home, which is really hard. Like I said, I haven't seen my son in like over a month, so it's very difficult. But you know, you need to make decisions about how rigorous you want to be, and only you can make that decision right now with the guidances that you're learning from the resources that I told you about. Caring for your family at home, we also have some resources on here for actually caring for them. You know, we have a lot of families now who all of a sudden they're home with their special needs child all day. They are also home with their other children and their other children are being expected to be schooled, right? You have to school them, they have to take online classes, and it's fairly overwhelming. We've had some parents who are just like, you know, yeah, I want to keep the special education going with my special needs child because, you know, we'll just make that work. We'll have them meet with their teachers and we'll do therapies online. And others have just said, we just can't do that right now. We just need a break from that. And, you know, I don't think there's any right answer. I think you have to make decisions, you know, for your family on what is manageable and what's achievable. And so, you know, some families that have multiple young children at home that are still in school are now teacher, you know, principal, lunch lady, and they have a special needs, you know, child at home too, with all of their physical and mental and behavioral needs as well. So please check out the resources here. I think that could be really useful. as far as accessing medical care during this time, we do have some resources here. Next week, we have a webinar from Dr. Anut Patel. He's the head of our professional advisory board and a pediatric epileptologist. He's going to talk about specifically about getting medical care during COVID-19. So I would really encourage you guys to sign up for that webinar. We do have a page on our website. It's LGS Foundation under events, our webinar series. We can also make these links available, but I really hope you'll join how to manage LGS during the COVID period. And we can also try to put these links up on our COVID page. But if you can't make it, we certainly will record them as well. But definitely take a look at accessing medical care. The idea is that you really, most sources, the CDC, the states, and the local governments and hospitals are saying, don't come in without calling first, right? If you need to go to the emergency department, call your doctor first, and make sure you have a phone number where you can reach the actual doctor and not just their leave a message here line. So you can, if you do have a true emergency, that you can get through to this person. Maybe it's through your, I don't know, maybe you have a way through your MyChart or their direct phone number. I have my daughter's neurologist's phone number, his direct cell phone line. And so I don't think it's unreasonable. Don't abuse that, but also it's not unreasonable to have that call before you go in, and they can make arrangements to make sure that you get in with your loved one with LGS into the emergency department in the safest way possible. Make sure you don't already have COVID. Make sure that you're separated from people and exposure to COVID. Call ahead first. And if you can, whatever you can do to prevent having to go to the hospital right now, you should do that. I mean, I feel like at least once a day I have to say to Savannah, stop doing that. We can't go to the ER right now. Stop jumping on the bed. Stop doing that. So, these crazy things that she does, stop walking around the house without your helmet on, it's not a good time. But if you have to, it's not unheard of. Our friends at the Autism Science Foundation actually have a really nice emergency department information about, this was coming up in their community a lot, so they made some recommendations, so I hope you'll check that out. In terms of medical visits, most hospitals and doctors have gone to telehealth, so just phone conversations or video conversations. We just had our first video appointment with our doctor this week, so I would really encourage you to move to that for appointments with your professionals. As far as drug shortages, we'll put this up on the site. It's not up right now, but we've not heard anything about drug shortages in the LGS community, and we're working closely with our other groups to the Tuberous Sclerosis Alliance, the Dravet Syndrome Foundation, Dup15q, CDKL5, all these others, to keep our ear to the floor about whether there are any shortages. But the FDA does have a website, and we'll make sure this gets up here under Accessing Medical Care, where you can search if there are drug shortages and whether or not that's been resolved or not. So if you're concerned about a drug shortage, or if you hear something, the FDA is the go-to authority on this. You can search the drug, look it up, you can search it by name, or you can look it up alphabetically. And so that's really important. But so far, nobody's reporting any drug shortages. We did hear of a midazolam shortage, and then we circled back with the providers of midazolam. UCB has a drug called Nazolam that's out right now, and there are no shortages with that drug at all. So I think we're okay in that front. And if you hear of any drug shortages, please let us know at the LGS Foundation, and we will get the word spread as quickly as we can, and we can go directly to the sources that make this and prescribe it, and see what information they have about when the drug shortage might be resolved. We have some information on financial assistance resources. I know the PAN Foundation and NORD are offering financial resources during this time. I think PAN has like a $300, family help program, and NORD has something that's in the works that's just being rolled out. There are also a number of patient assistance programs for prescriptions, so waiving copays, offering copay help from a lot of the makers of the drugs that are out there, so please check those out. And all of this, again, is on our COVID-19 website page at the LGS Foundation. You can just go to resources, COVID-19, and it's right here. During this time, it's really important for us to be thinking about self-care. If you can't if you're not taking care of yourself, you can't take care of the rest of your family. If your bucket is empty, you've got no water to give anybody else. So I really encourage you to take care of yourself during this time. Last week, we're working on putting this up on the website. It should be this week. But last week, Amanda Cothern gave a really nice webinar where she talked about self-care and caring for yourself during this trying time. And she just had 10 tips that were really useful and helpful. We're all stressed. The whole world is stressed. Try not to take out your stress and anger on your family or on the rest of the world. If possible, we need to be kind, but do check in with yourself. How are you feeling? Ask you. I was on the phone call last week and somebody went around and asked us how we were all feeling, and none of us had really thought about it. Like, I don't know, I'm just feeling a lot of things. Relax, breathe if you need to. Don't hesitate to set boundaries. A family that comes in and says, listen, I need to discontinue special education right now, or I need to drop this thing. Be kind to yourself and set boundaries, on yourself. You have to, shut off the computer at a certain time, or you have to have your own alone time. Treat yourself to fun things. I would really encourage you guys to watch this webinar, but find a book or a movie to take you out of the whole COVID drama at the moment, if you can. Try to get yourself into a routine, prioritize sleeping, eat. This is not the time to go on a diet right now. You have enough stress in your life, and commit to taking care of yourself. It was a really good webinar, and just a reminder that, many of you guys on this webinar are the people, the glue that are holding it all together for your family. So please take care of yourselves. See if I can go back a slide. Does not want to go back, so sorry about that. So please take care of yourself. Self-care is wise. And then I just finally want to comment on 2 more things, and then we'll open this to questions. If you do have any questions so far, you can please put them in the chat or in the Q&A on the side, and I'll try to answer them the best that I'm able to. At the foundation, we are trying to keep our ears to the ground, as I've mentioned a number of times. We're listening, obviously to the governments. We're listening to the FDA. We're listening to the Center for Disease Control. We're listening locally about what we should be doing. And, we're trying to provide that information to here. It's here on our website, the links that we're following closely and that are scientifically backed. We are also working with our partners to keep an eye, like we said, on things like drug shortages or problems that are arising in the community. Many of our kids have had infantile spasms previously. And so in the community, there's an effort right now by physicians and patient advocacy groups and many others to really understand, how are we going to treat infantile spasms, which are a medical emergency during this time. So how are we going to treat those if you're a family and you suspect spasms? So, as problems arise, the community is coming together to really tackle those problems. And it's actually really been kind of exciting to see. Scientists have come together to study COVID, to push things forward. Silos are being broken down, people are collaborating, and this is true in the nonprofit world as well, to really just try to get help to our families as quickly as we can. We are hosting a series of webinars. Again, you can go back to the site on the LGS Foundation page here for webinars. Mine here today, and then of course Dr. Patel's next week, and then Dr. Cothern, the one I was talking about, caring for yourself. And then we'll have these webinars up, and there's so many webinars that are going on out in the community. I've seen everything from free resources, webinar and free resources to help your kid learn at home, right? How to get free Zoom, how to get, free ABC Mouse for your kids that are typically developing. There's, for our special needs kids, it's the help is coming a lot more slowly, but we do have people in our community that are working on that. How can we still do their kids' therapies? How can we still move things forward with them and their learning, if that's something we can manage? So we'll keep bringing you that information as we learn it, and it'll be on our resource page, and we'll be updating the private support Facebook page. So that's probably the best source for your updated information from us. We're also hosting more virtual meetups. We are genetically programmed and wired to be social creatures. So please join our meetups if you're feeling alone and isolated. We've got bingo meetups just to play games. We've got coffee chats, if you want to just talk about COVID and what's going on. We've got happy hours if you want, to do that and just go and hang with the ladies. And all of our kids are on these meetups with us. So bring your LGS kid. Maybe they can't have any alcohol for happy hour, obviously. But, there's a number of meetups, and Kathy Levens at the foundation and is working so hard to host several of those a week. We'd love to have you on those if you're feeling at all isolated. We're also here for you. So if you have if you need help, if you have specific questions, and we will try to answer them. No promises that we will. There are just some questions that can't be answered, but we will try to find an answer for you. So please don't hesitate to reach out at jen@lgsfoundation.org or at info@lgsfoundation.org, and we're here for you if you feel like you need support in some sort of a way. We also are hosting a series of town halls. We're partnering with the 2S Alliance and the Dravet Syndrome Foundation for a town hall on May 1st. And that information will be going up on the website soon, specifically on accessing medications during this time and what we foresee for the future. So the foundation is just really trying to listen to all of the professionals that we work with and listen to the families that we're interacting with, and then listen to our other nonprofit partners and the families that they're interacting with try to get ahead of the needs that we have in the community so that they can be addressed. Oh, and last but not least, just from me, is what does the future look like? We don't know. I don't think you really expected me, hopefully, not to answer that question, but what we do know is that there is a plan. We do know that vaccines can work against viruses. With a vaccine, which I know is a very, very troubling topic. I have people in my family that have pretty significant vaccine reactions or have had them in the past. And so, but we do know that vaccines can work against these types of things. And so there is a lot of work going on to develop a vaccine for the people that, will then have to choose whether or not they get it. But we know that these can work, and vaccines take a while to generate. The data so far that's coming out is that our bodies do make antibodies against against COVID-19. Those antibodies do go in and they fight against the virus inside of us. And then that is the basis for all of the vaccine related research, is these antibodies and how you might, activate them in people who have never had the disease in a way that they just get, that they activate their immune response, but they don't get the virus. So the vaccine, they're saying, can take as long as a year to develop, but they are working on it. There's also a lot of work going on with antibody testing. So taking a blood test, I could go get a blood test. Well, maybe not right now because we're all kind of on quarantine, but before the quarantine and in some cases I could go to see if I've ever had chickenpox. So it's a blood test. They draw blood and they can see if I've ever had chickenpox, if I've ever had, other childhood diseases. I'll be carrying those antibodies inside of my body. And so they can test for those. It's called antibody testing or titer testing. There is work going on that. And there are, tests that are out there that are available, but some of them aren't doing that well. So, but it is coming. So watch the CDC, the Center for Disease Control website, watch your local governments, watch out for snake oil salesmen too, of course, that are just trying to sell you and get your kit and get your money, but it is coming. A day will come, we believe, the science is suggesting that we'll be able to know who's had it based on these antibody testings, the same way I can see if you've had chickenpox before, or see if you've had, measles before, or if that you're immune to measles, right? If you've never had it before because you got the vaccine, we can test that in people's blood. So that is coming too, but that will take some time. We do know that self-isolating works. We know that social distancing works. We know that washing your hands works. We know that wearing masks helps. So those are all things that are within your, that you can continue to do, and those do help. So what the future looks like, how soon we're all going to be able to go back out in the world and see our friends and get back to work and see our loved ones, we don't know. And for me personally, I don't know when I'm going to feel safe to go out in the world and risk bringing something home to my child. So it might be longer. Like they could release, tomorrow they could say, hey, everybody needs to, go back into, you can go out in the world, but you still need to maintain social distancing and you need to wash your hands and you need to wear a mask, but you can go out now. We're not recommending stay-at-home orders anymore in California and in San Diego. I'm not sure that I would go out because it's my job to protect Savannah, and I feel like no one else is going to do that for me. So we all have that decision to make. But just keep watching, like I said, the trusted sources of information. If you need to turn off the news because it's terrifying you and it's just making you stressed out, then it's okay to take a break for a couple days from the news or for a week. But none of us know what the future looks like. This affects the whole world, right? A virus that is new to mankind affects the entire world. And, we're all going to have to deal with this as it unfolds. The information is changing every day. It's evolving. And so, the things that we're learning, initially it was don't wear a mask. And now they're saying wear a mask because they now have some evidence to support that it can be helpful. It's not going to be 100% protecting of you, but I always think of it as like football players getting through the door. If you have a virus particle, and it's clumped, with a bunch of other virus particles, like 10 football players trying to get through a front door, then a mask might stop that. But if you just have a single tiny one, maybe that one does get through with some masks. And even the respirators, I think, have a 95%, stoppage rate for the virus. So nothing is perfect, but masks can help. So we do know that. I also know that we're all in this together. So we are here for you at the LGS Foundation. I know Jen and Kathy and myself and Kaylee are here. If we can be of help, please email us. We are trying to find the answers in this really trying time. Please join us on one of the meetups, especially if you're feeling isolated. Please invite other families, even if they don't have LGS, but they're all welcome to come and just enjoy some social interaction with us, if that will be helpful. So, and with that, I will happily take some questions. I see there's a couple here. So, Jen.
I also think that, I think I think that we are a community that really values our connections with one another. And we've always been really connected on our Facebook group. And these meetups are just another opportunity to bring us all together. There are a couple of questions there. And some comments. I'm going to start with the question that came through to me before this began, as I was emailed a question, and it was two questions, and one of them you sort of answered it in that it was, she said, I keep hearing guidelines for opening up, and I believe she means opening things up as in making public interactions available again to us all. And she wanted to know if LGS has guidelines specific to our community with regards to that. And you and I chatted about that a little bit. And I don't know if did you completely address that one? Do you know if you talked?
No, I mean, I don't think there are any guidelines. I think the guidelines that are coming out right now is that states are getting together, government is all working together, the different branches, and the different scientists that are out there and the different entities like CDC and the FDA, they're all getting together and they're saying, what would a guideline look like? How should we think about opening up our states, our cities, our businesses? And so the guidelines really that are coming out are relating to, opening up the country, opening up the state, opening up the city, opening up small businesses again. And those guidelines are going to be different, and so I think right now the experts are all trying to come up with what do those guidelines look like, right? Do we all just get to go back out in the world all at once? Is it tiered, right? So maybe essential workers, and then there's a next level of essential workers plus, they weren't essential in the first round, but now they're considered essential because maybe now we're running out of something that needs to be produced by that group, or maybe groups that need to go back out because their business is going to shut down if they don't, their small business, and so maybe they release people slowly. I do know that we are hearing in a lot of these over and over is that the medically fragile should continue to hunker down, even in these guidelines, right? To continue to self-quarantine. They seem to be coming up in a lot of the guidelines, as if you've got a medically fragile person that would maybe not do so well if they got COVID, then, you know, you really want to keep practicing social isolation and hand washing and self-quarantine and limiting people into your home. But there are no guidelines that I'm aware of yet for opening the country. I think they're still all being drafted or opening up even the states or the cities. And so they're all still being drafted. And so there are no LGS specific guidelines that I can kind of speak to, but we'll keep an eye out for what's going on with the country and the states for sure.
And the second part of her question really is, you know, should we wear face masks as a family when we go out in public? And should we ask others around our children to wear face masks once we are able to start being around family and friends again? And then there's another question that I think ties into this that says, what kind of masks should we use and filter? So that's kind of all part and parcel of the mask question.
Yeah, no, absolutely. So the CDC does actually have on their website information about cloth covered face masks, how to wear one, you know, a homemade one. So, so if you go to our COVID page, you go to, you know, the CDC, which is the very top one here. It's actually right on their homepage. It's right here, cloth face coverings. And what they're really saying is that it can just be a simple cloth face covering. Obviously, you need to be able to breathe, right? So, but obviously more layers is better, right? So you could take a t-shirt. I'm not wearing a t-shirt, but you could take a t-shirt, double, triple folded, a bandana, you know, these cloth face coverings. They're suggesting you can make them as well. They should be washed regularly, but you could put these things over your face as another layer of protection. Now, the science on this is that they offer a layer of protection, but they are not a fail-safe by any stretch, but they are better than nothing. And they do help with touching your face, for sure. Like, we all seem to, it was so interesting, but I was talking to a friend and she's like, all of a sudden they're telling us not to touch her face, and I just can't stop touching my face. Like, I touch my face so much. I guess I just love myself that much. It's like how much we really touch our face in a day. But this is a great link to go if you really want guidelines on that. It should fit snugly. It should be secured. It should have multiple layers of fabric, but you have to be able to breathe without restriction. You know, you want it to be a breathable material where you're not going to get overheated, and you should be able to wash it. So, but you know, I think that you have a lot of options that are out there. There are so many people that are sewing these things. You know, the people that, for the community that is practicing social distancing, the cloth face masks are great. For those on the front lines, they're not recommending cloth face masks. They're recommending like the N95 respirators, you know, and our frontline workers need them because there are massive shortages of those types of masks for them. So I would recommend the cloth face mask, but they are saying that you should still practice social distancing even if you have when you have on this mask. Still wash your hands and all of the things that you were doing. So the mask is not, you know, to let your guard down. You still need to be, you know, 6 feet away. So.
And a couple of comments here. One was from Kathy Levins, who is with the foundation, our director of programs, particularly the ambassador program. But she also said that the White House has released a 3-phase opening up America guidelines. And the web address for that is whitehouse.gov/opening-America. So thanks, Kathy, you know, for if that offers some information for you. And then also Andy Cooper has offered to share the portal that she created for work. It is all about special education activities and resources that target around a preschool age group, and then some sites that do go up to the higher grade levels. And thank you very much for that, Andy. And you know, if anybody's sharing information with me, if you have email or questions for me afterwards, if you're not in our Facebook group, or if you don't visit our website very often, or if you do visit our website and you see the recording of this afterwards and there's something that you have questions about, my email, I don't think I even introduced myself at the beginning, so I'm sorry, I'm Jennifer Griffin. So it's Jen, Jen, at lgsfoundation.org. If you do want to email me with any follow-up questions for Tracy or for me, or for any of us at the foundation. Kelly asks a question, for those families that have stopped in-home nursing, when would it be a good time to begin services again, and how do we make that decision? How do we make that decision?
Yeah, it's a really difficult question because, you know, a lot of our kids require day nursing and night nursing. And we know that every time you let somebody into your home, there's no guarantee that they aren't asymptomatic but still they can give it to you, right? Or that they're pre-symptomatic and they can still give it to you. They're still contagious. In addition, we're not sure that people who have already had it, the science is actively looking right now, but we don't know if you can get this again. We know that with things like chickenpox, right? You can get another version of it called shingles later, right? It lives for a while and then it can come back as shingles in some people. We don't know if once you've had it, you're done, right? Or not. And so the scientists are looking actively to try to figure that out. You know, all I can say is, you know, as you make this decision about bringing nursing back in, you have to look at all of the things that you're dealing with, right? So if your kid if you can manage without the nursing, and your kid isn't like on the brink of having to go to the hospital every hour or so, then, you know, the only way you could guarantee, you know, that COVID isn't brought in by a nurse is by not having nurses come in. You know, I think that if you can't manage, you know, and your kid is really severe and needs a nurse, or you're single parent and you get no break, that you sit down with your nursing staff and start talking to them about their life, and who they're in contact with. You know, we have a really close circle of friends. There's basically just a few people on our street that we interact with, and all of them are home quarantined except one person, and that one person is a critical worker. And he's an auto mechanic, and so he's out in the community. And so if we get COVID, it's either going to be from that guy, right, or bringing it home, or, you know, like a trip to the store for essentials. You know, I think that, but you have to balance that. It's like, if you're a stay-at-home and you're alone and you have no help and you're going crazy, you have to try to find somebody who has a very limited circle. If they're under self-quarantine themselves and they're taking all the precautions, then, you know, I think you can think about that, about what you're comfortable with. You know, I'm not, you know, I don't think that anybody in my family has had COVID yet. I mean, we've certainly have had little illnesses here and there, but I don't think we've had it. I don't think that we will never get it. I think that, you know, we will have it at some point, unless we're just, you know, one of the very few rare people that, you know, are just immune to it naturally, which is probably possible. But I do think that I don't want to get it when hospital resources are so limited. I don't want Savannah to get it when hospital resources are limited. I don't want Savannah to get it if I can wait a while for a vaccine or for a treatment. There's a lot of, I didn't mention this, but there's a lot of treatment testing that's going on in scientific labs right now. Are there any effective treatments? We know one thing that is really effective at saving COVID patients' lives, which is intubation machines, you know, breathing machines, which many of our kids have been intubated. And so those can be in shortage. And there are certain areas like in New York and LA where they are running in shortages. And so, you know, we're spacing it out when she might get it, and maybe even holding off until there's a treatment or a vaccine, which will come in the next, you know, year, we hope. Does that mean we have to self-quarantine for a year? I mean, we can't make that decision. You know, you have a lot of factors in your life, you know, around that, but those are some things that you can think about. You can think about, you're not going to be good to anybody if you have to provide 24/7 nursing, you're single, you've got other kids, you know, you're still trying to make money and work and do all these things. Like, if you need help. So you need to think about that as well. But you also would have to really limit, you know, you'd want somebody who's really limited. Maybe they're on quarantine too, and they're just in with their family, and hand washing and social distancing and mask wearing and all of those things. So it's not an easy answer, and it's not an answer I even have. It's just, those are things that you can think about as you think about making a really crappy decision. I mean, you're faced with just a really horrible decision about, do we get nursing care or do we not get nursing care? You know, do I see my loved one or do I not see my loved one? It's just that whenever like my son comes home, he doesn't come home, but like whoever comes into my house, they're not just bringing themselves into my house, they're bringing everyone that they've come in contact with into my house. You know, it's sort of like that old STT campaign. Remember the old STD campaign? You're not just sleeping with the person who has, you know, you're sleeping with the person, every person they've ever slept with who might have given them a sexually transmitted disease. Do any of you guys remember this? Are you too young? But it's that same kind of thing, and they can be a carrier and you just don't know. And I'm not saying that we need to be afraid 24/7. I know fear and anxiety and anger and frustration are really on the rise right now. But we just need to make the best choices possible, given the fact that we're all still trying to run our households, that we all still need money to pay our rent and for food, and, you know, and that we are social creatures and we need help. So I wish I had an answer for you, Kelly, but that's the best I can do.
You know, Tracy, on the heels of that comment, I know I've heard that the second wave is potentially going to be worse than the first wave, and the second wave will be probably in the fall and probably around the beginning of flu season, so they're saying, or at least this is what I've heard. So I'm wondering, you know, first of all, when is the beginning of flu season? And secondly, you know, perhaps this is something that as a community, we have to sort of prepare for a little in advance, in, you know, thinking that potentially we may be all shut down again in the fall or whenever flu season and COVID starts to resurge.
Yeah, I mean, I don't think we have any idea what's going to happen. We know that this is different than the flu. It's much more, it's much more infectious than the flu. And there are certainly websites I can point you to if any of you guys want to go deeper into the science on this. Mostly we're just trying to help families, you know, cope with the things that we have on our LGS page, but we can certainly put some scientific information. It is you know, more infectious for sure than influenza. That comes around, including the H1N1 virus that we had some time ago. But it's not as bad as some of the other ones that we've had in the past. So we also know that flus like this, you know, it is a virus, they do tend to pop up. We know for sure that COVID lives on surfaces, and when it's hotter out at higher temperatures, it lives less long on surfaces. And so that's why, you know, and that's true for viruses and colds in general, and for bacterial infections too, that are spread through like mucus, that and that why you see a resurgence, you know, in the fall, in addition to all of our kids going back to school and being put together in common buildings. And so, you know, I don't think anybody knows really what's going to happen next or when the virus is going to happen. I think that it's naive to think that everything's going to be back to normal, you know, by, you know, summer. I think that all of us, none of us are strangers to grief. None of us are strangers to post-traumatic stress disorder in the LGS world. I think that's coming for humanity. I mean, we live with traumatic stress disorder. There's usually no post in our lives in the LGS world, but, you know, those things are coming, and we're kind of seeing it now. At first, people in the world were scared and anxious, and now they're getting angry, right? This is grief. They're grieving, you know, we're all grieving and should take time for that. But, you know, there are states and groups that are canceling everything out to the end of June now, right? At first it was kind of like, you know, everything will be out open by Easter. And then it was like, oh, okay, May. And now it's the end of June. I think it's the evolving state of science. What I can tell you is keep an eye on the Center for Disease Control website if you're in the US, the WHO if you're not in the US. Keep an eye on your state COVID page. Keep an eye on your local COVID page for the factual information about what's being recommended in your area. Obviously, the recommendations in New York are much more, and Los Angeles right now, which are major hotspots for the virus, are different than the ones that are in places where they've only had 1 or 2 cases so far. So very, very different. But if you have questions, so if you have questions or if you're struggling with something, please let us know, and we'll try to help you, try to get your question answered. If you know of resources like you were talking about, Andy, please share with us, and we'll share them broadly with the community. absolutely. So we're all in this sort of together, to be a community that supports each other during this time. And we'll try to get the resources to you as quickly as we can and we learn about them. But do keep an eye on those pages. I would suggest if you're looking for, the factual information on kind of where we're at. And then if anybody wants to know more about the science of COVID, I'm always happy to talk about what we know and what we don't know, what we think we're learning, and what the sources of information are for that. So.
Thanks, Tracy. I don't see any more questions right at the moment. So if you do have another question, I'll give you a moment to type it in. And then if we don't see any new questions coming up, we can finish a little early. I just want to remind everybody that so our next webinar will be the 28th, which is a week from yesterday. So it'll be the Tuesday. Thank you, Tracy, you brought that up. Thank you. And it will be, you'll see the times there, 7 p.m. Eastern, 6 Central, 5 Mountain, and 4 o'clock Pacific. So same time as today's webinar, and that will be with Dr. Anup Patel. And he will be discussing really his experience with COVID-19 and the rare epilepsy community. So, this would also be a lot of the questions that you asked today, I would think to ask them again next week of Dr. Patel, because I think that a lot of the questions, when you discuss it with your child's neurologist, you might have a variety of different answers. So it's always best to work with that person. And a lot of the things like, when can we go out again? Well, that really depends on our communities and where they're at with the flattening of the curve. So, but even then, do we want to stay home that much longer, given the fact that our children do tend to have some really, they tend to be pretty fragile. So, and those are conversations that you want to have with somebody. You want to be able to sort of hash it out and talk it out with somebody. So, Tracy, I don't see it. Okay.
Oh, I commented to Taylor. Yeah, I was reading in the chat box, which I think all of you guys can see. But I know that for families that are ending up in the emergency room right now, I know Taylor has a story about this, and I know Isa from Ring 14 has a story about this. It's a really scary time, so I'd really encourage you to go to our webpage and read about being in the emergency department, during this time. It's under accessing medical care, this one here. And it's just a totally different ball game. Call ahead for sure, but if there's any fever associated, it's really scary. What I did see that was really interesting and hopeful for me was that all over the world, pediatric epilepsy specialists are now talking about what they're seeing when their patients with epilepsy come in, and their fragile population too, when they come in with COVID or without COVID. And so they're starting to put together some guidelines on, what to expect. Are there neurological symptoms in patients who don't have, epilepsy, but get COVID, right? And they're seeing that in small numbers, but not in huge numbers. But the data is still very preliminary. And they're starting to ask too, like, what if a bunch of, really severe DEE kids come in and with COVID, and what does that look like? And how are we treating them, and what's been their journey, right? And has it been devastating? So it'll be really interesting to see when that is finalized, but it's good to see the doctors all working together to paint a picture of maybe what to expect if your epileptic encephalopathy kid gets COVID too. So. The other websites that you can pay close attention to are for your hospital. If you have a specific hospital you're seen at, that'll one, a lot of groups are being burdened, or not burdened, but they're being regulated and told what to do by their administrations. So the doctors are being told what to do by their hospitals, who are being told what to do by professional organizations like the American Academy of Neurology and the American Academy of Pediatrics, and all the other professional societies that are out there. So you can definitely check out your hospital's page. Everyone has a COVID page at this point. So, all right. Well, I hope this was helpful in some way, shape, or form. Be kind to yourself during this really stressful time. Be kind to other people. I know it's tough to not lash out, but I wish that society would remember that sometimes when they're fighting with each other on the news. But hopefully this was helpful. And if you learn of any resources, or if you have any questions, or if there's anything we can help you with, please don't hesitate to reach out.
Great. Thank you so much, Tracy. And thank you everybody for attending. And this will be recorded and available on our website imminently. Thank you.
Bye, everybody.